So welcome to this Q&A session from the Fertility Alliance. Today we're joined by Clare Ettinghausen from the Human Fertilisation and Embryology Authority, the HFEA, which regulates clinics. And Clare's going to talk to us about choosing a clinic, which is often one of the most difficult things for fertility patients. And I wondered, Clare, if we could start by asking you, what do you think should be the starting point when you're looking for a clinic?
Thanks very much for having me, Kate, and very welcome to anyone listening. I'd encourage anyone listening, whether it's at the outset of their fertility experiences or kind of further through, to have a look at the HFEA website, which is hfea.gov.uk. And you can see some lots of helpful information at the outset of treatment about what to look for in choosing a clinic, as well as a list of all the licensed HFEA licensed UK clinics. You can search that by postcode or by the name of clinic. And really, it will give you an idea of the differences between clinics. You can look at the ratings that both our inspectors and patients give them, as well as some questions to ask before you start treatment about what treatment you are being offered, how much it might cost, and what you might expect going through that. So I'd say start with the HFEA website. That will give you an introduction. And it's really important to look for credible information. And at the HFEA, we provide completely free, unbiased, and impartial information for anyone having treatment in the UK.
So do all clinics offer the same things? Do they all offer every type of treatment?
So that's a really good question. So the answer is no. Different clinics may offer different treatments, but within that, it's that they may offer different treatments to different patient groups. So uh, most people in the UK, unfortunately, are paying for their own treatment because there's a real lack of NHS funding. So if you do have NHS funding, you may find your choice of clinics is quite limited. It may even only be your local hospital that offers it, and it should be that you'll go in there and you'll be offered the same treatment as anyone else. Where clinics differ is some clinics particularly target kind of younger age groups or perhaps even older age groups. So it's worth having a look at what sorts of treatment the clinics provide. But for the kind of standard treatments that most people will have, they should be able to get that at any clinic in the UK.
And for people who are actually paying for their treatment, do the costs vary very much between different clinics?
They do, and unfortunately, although we are the regulator of fertility treatment and embryo research, we have no powers over the costs of treatment. So clinics, essentially, like anything that you pay for, whether it's your mobile phone or your kind of TV subscriptions, clinics can charge, whatever they want. There is quite a competition between clinics, particularly in areas around kind of the big cities, across the UK and particularly in the southeast of England, so that clinics can be quite competitive to price differently between each other. And again, I'd say to really have a look at the detail of the costs before anyone signs up to a contract or starts treatment. So before you give over any money, like with any purchase, really have a look at what the terms and conditions are, what is being covered, and you can ask questions like, what else might I be asked to pay and why. Again, if you have a look at on the HFEA website about the questions to ask before treatment, you can see some quite detailed questions about costs that we encourage people to ask. Appointments could be quite short, can't they? Whether they're in person, online, and you can always follow up with an email. It doesn't always have to be on that initial consultation. You can follow up with an email, and you can take your time, compare the costs, and really ask questions about why the costs might vary and what are you getting for that money.
So the headline costs that people might see on clinic websites are not always exactly the amount of money that people might pay, are they?
Unfortunately not. And it's really kind of similar to other things that we buy. We see something that says, it come to us, it costs X amount. And then when you actually sign up, you find, a bit like with airlines, you add on your luggage, you add on your boarding pass, and it suddenly builds up. So I think it's really, really important. Almost every clinic website now, you can download from their website detailed information about costs. I download that, have a look into it. But then, especially if it's your first cycle of treatment, some of those things you won't know whether you might need them or not. So really ask questions at the appointments, whether they're in person or kind of by video conference. Take notes, record the call if you want, or the meeting on your phone. Take someone else with you to take notes. And then, you can pause. You don't have to say yes to anything at that stage. You can say, I want to think about it. You can go home, take your time, go back with questions via email or ask for another appointment if there's anything you're unsure about. But these are big, not only kind of decisions about your healthcare, but they're big financial decisions as well. So people shouldn't feel rushed into making those decisions.
Obviously, when people are considering a clinic, what they really want is a successful outcome. And how important do you think the clinic success rates that you publish are when people are making a decision?
It's interesting because we survey fertility patients every 3 years. And in the last survey that we did in 2021, actually the location of the clinic came out as the most important thing that people are choosing in how to choose a clinic. And, we know that even though you may have appointments online, there are appointments that need to take place in person. And having that convenience of being near your home or near your place of work or near a train station, that actually came out as the most important reason for choosing a clinic. Success rates are important and they do differ a bit by clinic. But what I would say is two things. One is, unfortunately, because we've moved to a new complicated IT system for recording success rates, the success rates that we have on our website are unfortunately a bit out of date. Secondly, success rates, although they vary a bit between one clinic and another, what you may get from clinics is success rates based on a particular group rather than kind of for your own success rate. So I would always ask the clinic based on your own medical history what the success rate of that clinic is for you likely to be rather than for any kind of group or groups of patients, because it may differ depending on what your medical history is, whether you've had previous cycles of treatment, etc. So I think it's worth asking the question, but I would say there are lots of other things to consider as well in terms of not only the location, the cost if you're paying for things yourself, and like anything, the kind of feel. So all clinics now tend to offer mostly online open evenings or open days where you can see a bit of the clinic virtually. You can see the doctors and nurses and embryologists who might be treating you. Some of them do that in person as well. That's a really good opportunity to get a feel of that, is this the sort of place where I want to, spend a considerable amount of time and potentially money as well.
What about multiple rates? Do you think that's something that people need to look at too?
Yeah. Well, the multiple birth rate historically from fertility treatment was about a quarter of all treatments that ended up in a multiple birth. And I can completely see why, that might be really attractive for someone, especially if you're spending money or going through, exhaustive and, stressful and potentially painful fertility treatment. What we do know, though, is unfortunately the long-term health impacts to both the mother and patient and the babies themselves can be quite severe. So the case of unfortunately neonatal concerns, long-term health impacts, both physical and psychological, can be really quite extreme. And that's why several years ago, the HFEA, together with fertility clinics and many of the patient charities, started a campaign called One at a Time to, really encourage patients that better to have a successful outcome of one healthy baby than potential risks of multiples. Um, we've now seen the multiple birth rate go down to just 4% across the UK. So we really see that the outcomes for patients haven't changed. The success rates from fertility treatments have continued to rise while the multiple birth rate has fallen. And what we've really seen is kind of more healthy babies and healthy mothers, which is what we all want from fertility treatment. So I would say that is important because that's a sign of a clinic really taking patient safety seriously. And ultimately, for all of this, what we want to see is, a healthy patient or patients and, a healthy baby born. And a clinic that takes multiple births seriously is one that would encourage patient safety, at its highest level.
You mentioned earlier that location was the number one thing that came out in the surveys as being the thing that made people decide where to go for their treatment. But how important do you think that is? I mean, I think a lot of people think now, oh, well, I'm prepared to travel, I don't mind.
Yeah, I mean, I think that's really up to people's individual choice. As I said earlier, with some people's NHS funding, that will be, sort of attached to one particular clinic or local hospital, so they may not have choices depending where you live. there's less choices in some parts of the country than others. But if you do live near a kind of big city or urban conurbation, or you're prepared to travel, then you might have more choice. I suppose, that's really an individual decision. You'd have to calculate the cost of travel on top of the cost of treatment, potentially staying overnight somewhere if it's not easily accessible from home. And I guess it depends on kind of what sort of flexibility you have in both your personal life and your work life. So I think that's really a personal decision. We do know people are traveling kind of across the UK and particularly within England. But that's really something that people will have to look for about whether that works with other things going on in their life as well.
The other really important thing during treatment is emotional support. And I wonder, do all clinics offer the same amount of counselling to their patients?
So the answer is no. So by law, and this, it's really important to emphasize this is set out in the law, all clinics must make an offer of counselling for anyone having any type of treatment. So whether that's you're a patient, you're a donor, you're a surrogate, etc. But the offer of counselling is something that we can inspect on. Do clinics offer that? That doesn't mean either that clinics have to kind of provide it. They may signpost you to somewhere else where you can get it. And we also know that many patients don't necessarily want that formal counselling, although others do. We've seen a rise in popularity of people doing counselling online rather than in person. But clinics do offer that in a really variable rate. So again, a sign of a clinic that really, offers emotional support to patients is really important. Whether patients want that through formal counselling, some clinics have support groups, others have even things like, walking groups that might meet on a Sunday. And people find different support in different ways, but it's definitely kind of at the outset of treatment or before treatment, we'd advise, as well as looking at things like costs, opening hours, does that suit you, depending what else is going on in your life, what emotional support is offered, particularly counselling, and what's the follow-up care going to be like, whether my treatment is successful or not. So all those things I think are really important before signing up to anything.
The other thing on your website that you have is patient ratings and inspection ratings. I wondered if you could just explain what those both are.
Yeah, so we have a huge amount of information on our website. Sometimes, I find things that I haven't even seen before, and I've been at the HFEA a number of years. So every clinic has its own web page on the HFEA website. So you can search, choose a fertility clinic, and you can search by, by alphabetical order if you know the name of the clinic, or by location. And on the clinic's webpage, there are some bits of information the clinic will update themselves. So things like donor waiting times, some of the opening hours, contact details, whether there's car parking, that's all for the clinic to update themselves. But the majority of information is what we update. So you highlighted success rates before. I said that that was unfortunately quite out of date, and we're working to update that as soon as possible with kind of verified information, which is really important. The other thing this patient can see is every single inspection report. So by law again, HFE inspectors who are trained either as clinical or scientific inspectors, they've got a background in the sector. Many of them have been embryologists. Some are midwives who want to move out of kind of day-to-day midwifery, but into other areas of healthcare. By law, they go into clinics every 2 years. And anyone who's interested, a patient or any member of the public, can look at all the inspection reports, sometimes going back decades, on the website. You can kind of see what our inspectors found and what our inspectors view. The inspection rating, unlike other healthcare providers, really relates to our only regulatory lever, which, if you like, is the length of a clinic license. So the HFEA was set up 30 years ago. We have very limited and kind of old-fashioned powers. But what we can do when we have concerns about a clinic is say, well, no, you can't have a kind of standard 4-year license. Actually, you can only have a 1-year license because we're so concerned about the level of patient safety or the safety of embryos or sperm and eggs being stored in the clinic. We can suspend a license or take it away. So what you can see, the inspection ratings, is what the inspectors thought in terms of the length of the license. And we can also see where other patients have given feedback. We asked 5 or 6 quite simple questions. Again, I'd encourage anyone listening who's had recent experience at a fertility clinic to rate the clinic. It will take about 5 minutes on the website. And you can see there what other patients saw. Importantly, because I know that there are lots of other kind of, almost TripAdvisor things that people look at, other sort of patient ratings and clinic comparisons are available. The difference with the HFEA ones is those ratings are looked at by before every inspection of a clinic, whereas others aren't. So for some clinics, there aren't very many, and we'd really encourage all clinics to publicize this to patients. They should be doing that. But we'd encourage patients to look at those and add their own comments as well. And where patients have given either compliments to a clinic, which is lovely for the inspectors to pass on to the clinic, but where there are concerns, those are directly related at inspection and followed up to ensure that any concerns raised, that actions have been undertaken, and those are completed by the clinic in a timely fashion. So that's really, really important feedback, both for us at the HFEA, but also for other patients to be able to see as well.
The last thing I wanted to ask you was about the additional treatments which some patients are interested in. And are those listed on your website? Will people be able to find out which of those a clinic offers from the HFEA?
So yeah, this is a really kind of interesting part of medicine, if you like. They're what's called treatment add-ons. So they are what some clinics offer in additional to sort of the standard IVF package, and that's quite different. So I imagine if I went to for an appendix operation, for example, at my local hospital versus one in, I live in North London versus one in Aberdeen, it would pretty much be the same, and I would kind of, I wouldn't really know the difference. With IVF, what we have seen is, particularly over the last 10 to 15 years, our clinics saying, as well as the standard treatment, I can offer you this add-on, which may cost more money and may increase your chances of success. What we do know from patients, even going back to the birth of the first IVF baby, Louise Brown, where her mum said, if I was told to stand on my head in Trafalgar Square for a week, if that would make a difference, I would. We know patients want to do everything possible to increase their chance of success, and completely understand that. What I would say is that for most of those treatment add-ons, there's no evidence that it will increase your chance of success. And what it may do is increase the cost of that cycle, and perhaps, depending on the cost, prevent you from putting that money towards another future cycle, which may have a greater chance of increasing your success. So we have what's called a scientific and clinical advisory committee that's made up of gynecologists, embryologists, expert scientists, and lay members who represent patient voices. They meet regularly and they look at all the published evidence of these add-ons and whether they make a difference, both for increasing the likely success rates from a cycle of treatment and other things like whether it might decrease the chance of miscarriage, or whether there are particularly groups like people at risk of certain treatments, or perhaps slightly older patients where the add-on might be of benefit. They've looked at all the evidence, they've looked at all the scientific and medical publications, and then they've rated each of those add-ons. So if you go onto the HFEA website and you look under treatments, there's a page at treatment add-ons, and you can see all the ratings. Does it increase the chance of success? Is the evidence clear? Is there no evidence? Could this add-on, in fact, put me in any danger? And patients can see that very clearly set out. They can also see links if we know some patients want a lot of detailed information. You can see links to all the scientific and medical publications on those, so people can read the information themselves. They can see our summary information that these scientific committees have analysed. So I'd say before, again, agreeing to any treatment add-on, have a look at the website. All clinics should be signposting to the HFEA website on treatment add-ons. We know some clinics don't agree with all the information. They say, that's well and good. We still think it's worth being done. And for some patients, some add-ons will be worth spending the money. So I'd say make sure, again, that look at the evidence for you with your medical history and your age and any other information that your doctor or your clinic is recommending, and make sure that you ask questions. Why is this add-on being recommended to me? What do you expect the difference will be to me? And why should I have it? Because it's about your own treatment rather than anyone else who might be treated, kind of whether in that clinic or elsewhere.
Claire, thank you so much. That was incredibly helpful and clearly a real wealth of information on the HFEA website for patients to explore when thinking about choosing a clinic. So thank you for joining us for this Fertility Alliance Q&A today.